visiting Dr. Mal Braverman at 8A East 63rd Street in New York, and we're here to discuss the newest techniques in cosmetic dentistry. Did you know that you can go from this to this in just 2 visits and with literally no pain? It's true. There are several options and procedures available, and we've asked Dr. Braverman to help us take a look at some of those options. Dr. Braverman is co-founder of the American Academy of Cosmetic Dentistry in New York and on the board of directors of the American Academy of Cosmetic Dentistry, New York chapter, and chairman of continuing education. As such, he organizes lectures for dentists to keep them updated on the latest techniques in cosmetic dentistry. Welcome to A Taste of New York, Doctor. Can you tell us what are some of the most up-to-date procedures available today to correct or enhance the beauty of someone's teeth?
Cosmetic dentistry has really made tremendous strides in the last 15 years. Porcelain veneering, which is covering the fronts of teeth with porcelain to make over a smile in a matter of 2 visits, is quite an incredible feat. Patients can come in on a Tuesday, have an impression taken, and the following Tuesday have porcelain veneers delivered and make their entire smile over. Also, there are simpler procedures. Whitening of teeth can really make a big difference. Teeth can be whitened with home use techniques where over a 2-week period of time, dramatic changes in the color of teeth by oxidizing out the stain that's accumulated over a lifetime. Bonding is another procedure which was really started this whole revolution in cosmetic dentistry, which is a matter of adding tooth-colored material to teeth to reshape them or fill in gaps or spaces, chips, cracks, and recontour and restructure a smile with a direct resin technique. Whereas it's not porcelain, but it's resin, it can be bonded. That can be done the same day and as a 1-visit procedure. It doesn't require a laboratory procedure to make up the porcelain. And the combination of bleaching or whitening, bonding, veneering, cosmetic recontouring of teeth, also minor tooth movement of teeth. It gives us pretty much every aspect of changing the structure of a smile. We can move them a little bit, we can reshape them a little bit, we can recontour them, we can add to them, and we can add resin or porcelain. And with that armamentarium, there's really no limits to what we can perform in cosmetic dentistry.
Doctor, let's start with porcelain veneers. What are they and how are they done?
An impression is taken of the patient's teeth at the initial visit. There's some reshaping of the teeth so that you'll get the most ideal final solution with the porcelain veneer. And then the models which are taken are sent to the laboratory. The laboratory technician then sculpts porcelain covers for the fronts of the teeth, almost like the front half of a crown or a cap, as people understand, without any preparation or any real drilling of the tooth or temporary crowns. It's a very simplified procedure. The veneer is fabricated out of porcelains and ceramics, very thin and very beautiful, to change shape and color and make them both ideal. The patient at the second visit, the veneers are actually bonded to the front surface of the teeth. The teeth are etched with a solution, makes them slightly porous to receive resins, which will actually make the porcelain adhere to the tooth on one side, and the etched surface of the porcelain, the resins adhere to the porcelain on the other side, and you can actually laminate teeth, much like a false nail is put on women's hands. You know, we can do a porcelain veneer in the same fashion.
Now, how are those different from fillings or crowns?
Well, traditionally, if someone really wanted to make a cosmetic change, one of the few options that we had were anteriorly would be full crowns, which is a much less conservative procedure. You have to prepare a crown into a thimble shape take an impression. You have to put a temporary crown on there while the final crown is made, and then the crown is placed, replacing just about all of the tooth structure. Whereas a veneer is very conservative. It's just bonded onto the front surface of the tooth. And so it's more conservative, it's quicker, it's pain-free. It can be done without any anesthesia, any needles, any drilling to speak of, because the enamel of teeth has no sensitivity. The tooth becomes sensitive in the second layer of tooth structure, or dentin. And very often veneers can be prepared just in the enamel of the tooth. There's no sensitivity. The patient leaves, and then it's placed on the front of the tooth. So it's much more conservative and much simpler for the patient. So when you think about it, it's quite amazing that today we really can restore the entire dentition without any metal, without gold inlays or gold crowns or metal crowns with porcelain over them, but rather we can make a porcelain crown that can be bonded right to the tooth structure. We can make a porcelain veneer that can be bonded right on the front of the tooth. We can make a porcelain inlay to replace fillings. In fact, with resin and porcelain, we can restore the entire dentition naturally so that it looks like you never had any dentistry. And in fact, the tooth structure and the dentition looks totally natural.
How long will they last, and is there any pain to this procedure?
Pain really comes most of the time if Novocaine or a needle is not given correctly. Here you don't even require any needles, so it's wonderful. That's something a lot of people have anxiety about, and that's history. It can be prepared without needles. It's relatively painless as a procedure. As far as how long they last, the first veneers veneers are, as I said before, the first case I did was about 15 years ago, and that was one of the first cases done anywhere. Veneers were brand new and just discovered. That particular patient, I saw him this week. His veneers are in the same condition they were when they were placed 15 years ago, with, some slight changes. The technology's certainly improved, but they're still there, all of them. So I would say to you, we don't know how long they'll last because they've only been around about 15 years, and we have that as a guideline. But my opinion is anything that can last in the mouth for 15 years could last you a lifetime. Let's talk about bonding. Who would be a good candidate for this procedure? It's the first generation of cosmetic dentistry. It's before we discovered veneers, we discovered bonding, and we did all of our reshaping and recontouring and adding to tooth structure, making it look different with by bonding resin to tooth structure, which is still done. That's the way we bond a porcelain veneer to tooth structure, is also with the resin. But we use the resin as a final surface when we do bonding. And the advantages of bonding are that it can be done in one visit. So if somebody chips a tooth or breaks a tooth and they have to do a TV show in the afternoon, they can come in, and within an hour that tooth can look as good as it ever did and better with bonding materials. Let's take a look at what's involved in the bonding procedure. The first thing that's done is the tooth surface is treated with a solution that creates a porosity in the enamel. And then the next level of a clear liquid resin is painted on the tooth and hardened, which flows into that porosity. It's sort of like a Velcro effect of resin. And then on the surface of that is the filled tooth-colored resin that actually changes the surface of the tooth. And that is cured or hardened with a very bright light. These resins harden when light passes through them. That's the way they're made. And then that allows the dentist to shape and contour the tooth. The decision to enhance your smile is a very personal one. Even a subtle change can make a difference in the way you look and feel.
If you have any questions on any of the cosmetic dentistry techniques that you've seen tonight, please feel free to call Dr. Mal Braverman at 212-688-3838. He'll be happy to speak with you and to answer any of the questions that you might have. For A Taste of New York, I'm Pat Mady.